our topic is the weight loss plateau. A lot of patients come to talk to me about their struggles. Their weight seems to be moving very, very slowly and they feel deflated and they feel frustrated. Am I really in a weight loss plateau, and what is it that I can do about it? I like to help them set the expectation about what happens during the weight loss journey first, because when the numbers are changing, then the denominator is changing as well. So for example, in the first phase of the weight loss journey, if someone is losing 10% and they're starting at 100 kilos, 10% of that takes them down to 90, which means that they've lost 10 kilos. In the second phase of the weight loss journey, if they're going from 90 down to 81 kilos, that represents 10%. But it's only 9 kilos of weight loss. And if, say, for example, in the third phase of the weight loss, they're starting at 81 and they're going down 10%, that takes them down to 72.9, and that 10% represents 8.1 kilos weight loss. At the beginning of the weight loss journey, the kilos will tend to come down very quickly and then they'll tend to slow down. But if you are being quite consistent in doing other measurements, such as your waist circumference, you'll be able to see that they continue to come down, and that is a sign that your body composition is changing. So if you're losing weight the right way, you're still nourishing your body very well, you're doing a lot of strength-based training, and you are losing that visceral fat around the waist circumference. Lastly, there is the need to consider whether there are any confounding factors, which for some people can be, you might be getting constipated during your weight loss journey. So making sure that you're well hydrated and that you're not getting constipated, and also considering your weight loss goals. So for some people, they might feel that their weight loss journey is actually slowing down, or it never really got off to a good start in the beginning. And if that's the case, then you need to consider whether you have addressed all of the factors contributing to your weight. What can you do if you are in a weight loss plateau? The usual answer is going to be change things up a bit and give the body a bit of a challenge. Change the protein to the carbohydrate ratio. And it doesn't have to be extreme. Doing simple tweaks to your intake is often enough to get things moving again and to rev up that metabolism. Patients are usually quite successful at accelerating their weight loss journey when they do slightly reduce their carbohydrate content and slightly increase their protein content. Protein is really important in terms of fueling the metabolism, providing a source for your muscles, and also for other parts of the body as well. So the group that I tend to look after are patients who are taking weight loss medication, because I do medically supervised weight loss. When they are taking medications that do tend to cause gas or bloating or reflux or constipation, some of those medications do tend to cause what we call delayed gastric emptying. Food tends to go in slow motion down into the stomach, and as a result, it can be very uncomfortable for them to be able to digest an entire palm-sized serving of solid protein. If their digestion is moving down quite slowly, they're going to feel that sense of indigestion, they're going to have that hold up, and then they're going to have those sulfur burps where the food is sitting there for a very, very long time, and then hours and hours later, the old smell comes out. And so that's why some people do have shakes, because it is already very packed down very densely in a powder form, and the liquid form tends to be more absorbable. So if you can find a shake that is higher in protein and lower in carbs, then that can be a technique that tends to help people to accelerate their weight loss when you're going through a plateau. What meal of the day tends to be better to use a shake if you're going through a plateau? I can tell you that usually it's going to be dinner, or who tend to have quite late night reflux, it tends to be the dinner meal that they tend to have problems with, and so having a shake for dinner is usually the best. The only exception that I say to that is if you're used to having dinner together as a family, it can be really socially awkward to have a shake when everyone's sitting around as a family at the dinner table and you are seen as the person who is the odd one out. Have a kids meal at dinner time. So the patients will often just have half a serving of a shake at afternoon tea. They've been able to take the time to absorb that separately. Just have a small amount. It's nice and comfortable. It's going to go through by the time that they are going to bed.